Infertility, the stage of being unable to reproduce. Intrauterine growth retardation, fetal condition characterized by failure to grow. Ketones, these are substances found in the blood which show that the body has used up all the available carbohydrate for energy and has begun to utilize protein instead. Often a woman in labor with ketones in her blood will feel shaky and weak, and labor can slow down. Eating little and often in early labor can help prevent this happening. Some hospitals put up a drip if a blood test shows that ketones are present. Labor, as the process by which the fetus, placenta, and membrane are expelled through the birth canal. Normal labor occurs at term and is spontaneous in onset with the fetus presenting by the vertex. The process should be completed with acceptable time within 24 hours vaginally, with no complications arise. Last menstrual period, LMP, this date is used to work out how many weeks pregnant you are. The count starts from the first day of your LMP. Latent phase of labor, also known as early labor. This is when a woman starts to experience contractions, which can be irregular in strength and frequency and can last from a few hours to several days. Some women will also experience backache. The contractions will, over a period of time, usually increase in strength and frequency until they cause your cervix, the neck of the womb, to dilate. Once the cervix is 4 centimeters dilated, the labor is said to have become established and the active phase commences. Lithotomy position, a position used for assisted deliveries, where the mother lies flat on her back, with her legs raised and apart, supported by stirrups. Lochia, for a couple of weeks or more after the birth, the woman loses a mixture of blood and mucus through the vagina, like a very heavy period at first, but lessening over time. It generally begins as a bright red discharge and gradually turns a brownish color. Some women find it becomes bright red again if they are too active too soon. Econium, the bowel contents of the baby at birth. Membrane sweep, a traditional method of trying to nudge the body into labor when overdue. The doctor or midwife does an internal examination and attempts to stretch the cervix and sweep a finger around the membranes. Sometimes this is enough to get labor going if the cervix is ripe. Miscarriage, spontaneous ending of a pregnancy before 24 weeks gestation. Multigravida, a woman who has been pregnant before. Multipara, also called a multipara, a woman who has given birth at least once before. NAD, nothing abnormal detected. The doctor or midwife may write this on your notes when they find no problems. Neonate, a newborn infant. Neonatologist, a doctor who specialized in the care of newborn babies. Obstetrician, a doctor who specializes in the care of women during pregnancy and childbirth. Occipito-anterior, when the back of your baby's head is toward your front. You may see LOA or ROA on your notes, which means left or right, occipito-anterior, and described whether the baby's head is toward the left or the right. LOA is usually the best position for a shorter labor and an easier birth. Occipito-posterior, as above, but the baby's head is toward your back. Edema means swelling. Fluid retention can cause swelling in your ankles, fingers, and elsewhere. You may see it measured in your notes as plus or plus plus. Oligohydramnion, decreased fluid volume for gestational age. Oxytocin, the hormone secreted by women when they are in labor, which stimulates labor contractions. The same hormone also stimulates milk flow from the breasts by contracting the muscle fibers in the milk ducts. Pediatrician, a doctor who specializes in the care of children. Palpation, when the midwife of doctor feels the baby by moving their hands across your abdomen. Pelvic floor, the sling of muscles that holds the pelvic organs in place. Perineal block, a local anesthetic given before an episiotomy is carried out. Perineum, the area of skin between your vagina and anus. Pessary, a special type of medication designed to be inserted into the vagina. In labor, prostaglandin pessaries are sometimes used to induce labor. Pethidine, a form of pain relief given by injection into the thigh or bottom. Pethidine usually makes women in labor sleepy and very relaxed. It can make the baby slow to breathe when they are born, in which case they may need an antidote. Placenta previa, when the placenta is low down. Sometimes it covers the cervix and blocks the baby's exit, in which case you would need a cesarean section. Placenta, the organ that develops in the uterus during pregnancy to transfer nourishment and oxygen to the baby from the mother's system, and to take away the baby's waste matter. Placental abruption, premature separation of the placenta from the uterine wall. Polyhydramnios, an excessive amount of amniotic fluid. Position, how the baby is lying, for example, to the right or left of the pelvis. Postpartum hemorrhage, bleeding from the genital tract during the third stage of labor, or in 24 hours after delivery of the placenta to the amount of 500 milliliters or any amount that will change the patient's condition. Postnatal, after the birth. Relates to the 28-day period following giving birth. Postpartum, relating to the period of a few days after the birth. Precipitate labor, labor that terminates in delivery of the baby in less than 3 hours. Preeclampsia, this is a complication of pregnancy where the blood pressure increases and protein appears in the urine. Pregnancy-induced hypertension, this means that your blood pressure is high as a result of the pregnancy. Premature rupture of the membranes, PROM, the rupture of the chorion and amnion 1 hour or more before the onset of labor. With PROM, amniotic fluid leaks form the vagina in the absence of contractions. If prolonged, presents risks for both mother and fetus. Presentation, the part of the baby which is coming first, usually the crown or back of the baby's head. Preterm, born before 37 weeks of pregnancy. Primigravida, a woman pregnant for the first time. Primipara, sometimes called the prim or primipara, a woman giving birth for the first time. Prolapsed umbilical cord, usually the baby's cord is born along with the baby and it continues to supply oxygen to the baby until it is clamped and cut. Occasionally, the cord slips down in front of the baby and the oxygen supply to the baby is reduced or cut off. This can happen with a breech baby or with a transverse or unstable lie. This is a medical emergency and the baby has been delivered very quickly, usually by an emergency cesarean section. Prostaglandin, a natural substance used in pessaries to soften the cervix and stimulate the start of labor. Puberty, the stage of development at the reproductive organs mature. Pudendal block, a local anesthetic given to block pain around the cervix and vagina before using forceps. Quickening, the first movements of the baby that the mother feels. Residual volume, the amount of air remaining in the lungs following normal expiration. Rhesus, RH, the rhesus blood group system is a way of categorizing your blood type. Rooming in, most maternity units now recommend that babies stay with their mums 24 hours a day. This helps with feeding and bonding. It also reduces the risk of infection. Rubella, also called German measles, if contracted by woman during pregnancy, it can result in birth defects. Rupture of the uterus, when there is a tear or cut in the uterus. It is one of the obstetric emergencies. Second stage of labor, the time from full dilation of the cervix to the moment when the baby is outside the mother's body. Pushing during the second stage can last from a few minutes up to a couple of hours. Shoulder presentation, when the shoulder of the fetus lies in the lower pole of the uterus in labor. A transverse lie becomes a shoulder presentation in labor. Show, a show is when the thick mucus which plugs the narrow channel of the cervix during pregnancy comes away. It is a sign that the body is getting ready for labor. Skin to skin contact with your baby after birth, your baby is dried and put straight onto your chest. Syntocinin, this is a synthetic version of a naturally made hormone called oxytocin which increases contractions. It is sometimes used to speed up labors that have become slow, or to Reduce bleeding after a baby is born. It is also sometimes given to speed up the delivery of the placenta. It is always given as an injection, either into a muscle or vein.